look at this and I think to myself, you're literally telling me you're going to take the white flag and stick it up and say, look, we suck so bad at treating childhood eating issues and controlling lifestyle. We're so poor at this that we're just going to say, the hell with it. Let's just drug it and surgery it. Now, here's the problem. Thank God for some common sense in this. A doctor out of California came out, a pediatric endocrinologist, said, look, he goes, this doesn't let us address the cause.
No, not at all.
We're completely ignoring what causes it, and we're just saying, the heck with it. Drug it. Now, of course, the author of the study says, you know what? This isn't going to happen. Our doctors are careful. Our doctors are cautious. They're never going to sit there and just throw a drug at it to try and deal with it because they know they can't fix it other ways. Welcome to pick anything. Diabetes, heart problems, on and on and on. Any GI issue you can conceive of. Asthma, on and on we go. And this is the best. They said, you know what? This is no different than if you have asthma. It's like an inhaler. Really? Because I'm pretty sure if you have asthma, if you just quit eating the wrong things, that doesn't always stop it. But with your weight, ironically, it seems to.
Amazing how that works.
Amazing. Couldn't believe it. Back in a moment.
You can't make this stuff up.
Well, it gets better. It gets better, right? Because, I mean, if you got to have one terrible article, there's got to be one to support it. Let's see here. I saw it here with diabetes. I know it's here somewhere. They're telling us that childhood diabetes, here we go. Childhood diabetes, guys, it's going up. It's forecast to go up about 673%. That's what they're predicting. A 673% increase in diabetes in children in the next 30 years. They said it's skyrocketed in the last 3. There's no reason to think this will change. It's just going to keep going. So why then treat it? We don't need to do that. We can surgically alter it.
Yeah, that'll work.
I think it's a great idea to start doing surgery on your 13 and 14-year-olds.
What could possibly go wrong?
And get the kids started on their drugs young, right? Because if you don't start them young, they don't really know the value of these things, right? They don't understand that. You want to get those kids started. I mean, you pop them off of that, put them onto their drug, get them started. You got them on their Prilosec when they're born now for regurgitation that all kids have. We got them on that. Let's get them on some asthma stuff, some allergy things. We got to have that in there. You know they're going to have some depression and anxiety kicking along here somewhere. Now we got to get them all fat and bloated. And when we get them all bloated and swollen and this and that, we can do surgery to help them feel better for a moment until we have to give them something else. Because there's never a complication that comes with bariatric surgery of anyone that's ever had it done. There's no complication with that.
At all.
And those drugs,
wonderful.
They're so successful, right? Because look at how well they've worked in our adult population for control. Of course they are.
They're safe.
They're safe. They're scientifically proven,
That's
Paulie.
right.
That's how this works. Follow the science.